Every year, Medicare makes some pretty major changes to their plans. This year, for 2023, most of the changes had to do with Part D plans. In this video, I'm going to explain those changes. All right, so here are the three major changes that we're seeing in 2023. The number one is insulin. In the past, insulin has been very expensive, and I'm talking about people that are insulin dependent, maybe on Novolog, Humalog, Lantus, some of those expensive medications. Now, for 2023, if an insulin is participating in the Medicare Savings Program, the most a person will pay out of pocket will be a $35 monthly copay. All right, and so again, a tremendous savings. Now, keep in mind, not all insulin manufacturers are participating in the program. Many are, but not all are. So you have to make sure that whatever you're taking is indeed going to be in that $35 a month program. And so the good news is they're no longer counting the retail costs, which means your insulin's not going to put you into the donut hole this year either. All right, and so that's a tremendous savings. Now, the second thing would be immunizations. Now, up to this point in time, Medicare has covered some immunizations. It would be COVID shots, flu shots, pneumonia shots, and hepatitis B. But those are the primary ones that were covered at a zero copay. This year, 2023, now they've expanded the list of immunizations. Basically, anything that someone would need that would be considered an adult immunization will be covered by Medicare at a zero copay, including shingles. And this was the big deal because shingle shots have been covered up until this year, but they were always covered under Part D plans, which were typically subject to, on the shingle shot, a deductible and or copay. And so it was not free at all. So this year, now we're going to have a zero copay whenever someone's going to need the shingles immunization, which is also that 2-round shot that most people get today. And then thirdly, what's happening this year is we're seeing some increases to the stages for all Part D plans. Now, again, all Part D plans have 4 stages. 1 stayed the same, but 3 of them, we actually saw some increases. And here in just a few minutes, I want to show you exactly what those increases are going to be.
Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video.
Now, before we get into those increases, I think it's very important for you to know these items here. First of all, there's 4 ways to get medications covered. So if you're new to Medicare, or at least looking at the possibility of going to Medicare, I want to remind you that when we're Medicare eligible, there's 4 ways to get meds covered. Number 1, you can stay on your employer plan. In other words, if you or your spouse are actively working and you're covered by a group plan that has 20 employees or more, remember, you don't have to do anything at all with Medicare, including Part D plans. Why? Because your employer plan has credible drug coverage. And so as long as you have credible coverage and you or your spouse still working, you can stay on that plan. You do not have to have a Part D plan until you either retire or decide to go on Medicare and come off of the employer plan. Number 2, you can also then get your drugs covered through a Part D plan. So if I don't have an employer group plan of 20 or more employees, this will be the primary option for most of you watching this video. Now listen, when we get a Part D plan, there's actually 2 ways in which we can do it. Number 1, we can get what's called a standalone Part D plan. These are standalones. These are separate. So keep in mind when someone has A and B of Medicare and gets a Medicare supplemental plan, that supplemental plan is not going to include a prescription drug plan. So that's why we have to have separate or standalone drug plans. In most zip codes, there's usually 15 to 25 different drug plans to choose from. So you get to pick and choose the plan that you want based upon the meds you take and the pharmacy you want to go to. So that's one way we can use a Part D plan, is standalone. Keep in mind, this is a separate company, a separate policy, as well as a separate premium. Those vary anywhere from $5 to on average $30 on a monthly basis. There's some much higher, but most people are not going to need those. But again, the average is about $25 to $30. So that's one way you can get a Part D plan. Another way is to actually get what's called an MAPD plan. Now, MA stands for Medicare Advantage. That's a Medicare replacement plan, an alternative to original Medicare. PD stands for prescription drug. So the MA covers our inpatient and outpatient, and the prescription drug plan is going to take care care of those self-administered medications. So when someone enrolls into an Advantage plan, they have the option to have that plan also include a Part D plan. So they're issued one card that's going to take care of inpatient, outpatient, as well as prescription drugs. So either way we go, the structure of a Part D plan in both of these are going to be the same. I'll teach you that here in just a minute. But the point is, if we get a Part D plan, it's one of two ways: standalone or embedded within my Medicare Advantage plan. Now, the third way in which we can get our medications covered is if you qualify for VA benefits. This means you served in the military and you've jumped through the necessary hoops for the Veterans Administration to say, this is what kind of coverage we're going to give you. Most of you watching this, if you do have VA benefits, you're going to be able to get your prescriptions through the VA at very, very reasonable copays, even on very expensive medications. Others of you are retired from the federal government. You were civil service, and you have what's called FEHB. That acronym stands for Federal Employee Health Benefits. And again, you don't have to get a Part D plan because part of your FEHB benefits, it will include prescription drugs. And again, you've had that all your working life, and then when you go into retirement, FEHB will continue to cover your prescription medications. And again, it's a credible coverage plan. So we have that as an option, or we have TRICARE. Now, the difference between TRICARE and VA means someone served in the military for a certain period of time, and they're eligible to get VA benefits. TRICARE means you're in the military up until retirement. In other words, you served in the military for maybe 20, 25, 30 years, and you retired, and you were given TRICARE insurance. So what happens when you're Medicare eligible, you actually have to enroll in a Medicare A and B, because now TRICARE is going to pay second to Medicare. And so you have to notify them, letting them know that you have enrolled in Medicare, and now your insurance with TRICARE becomes TRICARE for life. And so again, it's going to be secondary to Medicare. But what happens is TRICARE also includes prescription drug coverage. So you don't have to get an official Part D plan because you can get your medications using your TRICARE insurance. So this group of people right here do not have to have a Part D plan because all of those are considered to be credible coverage. All right. Now, there's a fourth way in which you can get your medications covered, and that would be through self-pay. And obviously, in my opinion, this is a very, very bad idea, and I'm explaining that in just a minute. So this is someone that decides not to get a Part D plan at all. And so I'm going to show you why that's really not a good idea. There's two reasons why you want to make sure that if you're not VA, FEHB, TRICARE for life, or you're no longer covered by a group plan, that you want to get a Part D plan. Number one, because medications can be very expensive. Now, you may presently not be on an expensive medication. You may be taking something that's very low cost. In fact, I hear this all the time. Some people say, well, I can get that medication at a cash price better than through a drug plan, or I can use a GoodRx coupon or Mark Cuban's a Cost Plus drug plan. That's true. You can, but problem is you're looking just at the meds you're taking now. Well, I know that sometimes people get a diagnosis in the middle of the year, they have no drug plan, and now they can't add one just when they want to. They're going to have to wait to add it later in the year, and now you're in a jam because you need an expensive medication and you don't have a drug plan to get coverage on that. So again, meds can be very expensive. I see meds on a regular basis, $7,000 for self-administered chemotherapy pills today, $7,000 a month. Had a guy the other day that was on a medication cost $16,000 a month. He told me that medication keeps him alive. Okay, so again, you may be taking stuff right now that's $4 copay or $6 copay or no meds, but that could change very quickly. Meds are very expensive. I had a lady recently that was on a medication that was $23,000 a month, and I'm saying to you, that's why you want to get a prescription drug plan, not just because of what you're taking now, but what could happen, because you can only add a drug plan if you don't get one when you first go on Medicare. You can only add one October 15th through December the 7th. Okay, you can add it, and then that plan would kick into effect on January 1 of that year. So what happens if you don't add a drug plan when you're first eligible? Now you're going to have to wait until this time of the year before you can do it. So let's say we have some kind of a serious health issue in March or April, and you have no drug plan. Well, you can add one later, but that drug plan is not going to kick into effect until January 1. And so now you're doing everything possible to get those medications because you did not have a Part D plan. The second reason you want a Part D plan is because Part D penalties are for life. All right. So here's what happens. For every month that you go without a Part D plan, you have a 1% penalty per month. Okay, so what happens if I go out that 1 year, I'm going to have a 12% penalty added to whatever my prescription drug plan is going to be. Now, again, the biggest risk is not the penalties, even though they can be substantial and they are for life. The biggest risk is up here. If you need an expensive medication and you don't have a prescription drug plan, now you're going to be paying full retail cost or doing whatever you can to get that medication. Now, next I want to quickly review the 3 features that are going to be common on all Part D plans. Remember, we can get that Part D plan as a standalone, separate plan. If we have a supplemental plan, we have a separate drug plan. Or if it's embedded within the Advantage plan, remember the MAPD plan. There's 3 features that exist in both of those systems. Number 1, every drug plan is going to have a network of pharmacies. And here's the key to this. Some pharmacies are going to be identified as a preferred pharmacy, and the rest are going to be identified as a standard pharmacy. Okay, and so what happens is when you pick a drug plan, it's very nice to see, if possible, that the pharmacy you prefer is considered to be a preferred pharmacy on that plan. And again, every plan is going to identify maybe 2 or 3 pharmacies. One plan may say our preferred pharmacy is, Costco and Walmart. Another one may say our preferred pharmacy is Walgreens only. Another one may say it's CVS and maybe local grocery stores. But they're going to identify some preferred pharmacies, and then all the rest of them you can probably get your prescription filled, but again, it's going to be at a standard price. And again, whenever it's generic type medications, there's a minimal difference. But if it's brand name, I've seen significant differences. And so that's why preferred and standard is going to matter. Number 2 feature will be formulary. And frankly, this is really the most important part of a drug plan. The formulary is nothing more than the list of medications that are going to be covered. That's the formulary. And so whenever you look at prescription drug plans, you want to make sure your medications are covered. Sometimes people just focus on premium alone. Now, I care about premium, but premium is not the biggest issue. The biggest issue is, will my medications be covered? Are they listed in the formulary as covered medications? So that is really what's going to matter. Now, when you look at standalone drug plans and you see some that are $5, $7, $10, and you see some that are $50, $60, $70 up, what's the difference? Well, the difference is the formulary size. So if I'm looking at a plan that has maybe a $5 to $10, $15 premium on a monthly basis, I'm looking at a good drug plan, probably has 3,000 meds to choose from. If I'm looking at a plan that's maybe $25 to $30, $35, $40 a month, well, that's going to be a little bit of a better plan. It's a larger formulary, more medications, especially brand names will be in the formulary. And a best formulary would be a medication list that probably has anywhere from 5,000 to 7,000 medications covered. Now, the premium could be $50 to $75, but sometimes if someone's taking a tremendous amount of medications, especially a lot of brand name meds, they're may need to upgrade to that kind of a formulary to get their medications covered. So again, premium is not the issue, folks. Formulary is the most important aspect. Now, there are some issues within every formulary that you need to be aware of. Okay, number 1, there will be some medications that are what we consider to be NC meds. Those are not covered. There are some meds that no plan is going to cover, but every plan is going to have some meds where they say we're not going to cover that medication. So that's why you got to make sure your meds are covered if it's possible. Okay, number 2, every plan is going to have some medications that when it's in the formulary, it may have these initials QL beside it. And what that simply means is quantity limits. That means that Medicare says there can only be, 30 pills in that bottle, or maybe there can be 90 pills in the bottle, but they put a limit as to how many pills can be in that bottle. And these are typically things that could be addictive or maybe expensive. Medicare says you will get the prescription filled, but only so many pills in the bottle. The third thing you have to realize is that some medications are going to have beside the letters ST, and that just simply stands for step therapy. And what that means is you've been prescribed a medication where there are some generic equivalent or generic alternative medications available. And so if you've never tried those generic equivalent or alternatives, then you're going to have to. You're going to have to step therapy. You're going to have to try the lower cost medications. If they're not working or they haven't worked in the past, then your doctor has to fill out some additional paperwork saying, hey, that's not working for us, and so we need that brand name medication. So you're going to have to start with the cheaper stuff and kind of walk your way, and they go through this step therapy process. Okay, and again, not all meds are going to have that, but some are definitely going to. And then there's going to be some meds that are prior authorization. That means doctor prescribes a medication, and when you go get it filled at the pharmacy, then there's going to have to be some additional paperwork that will be supplied by the doctor, basically saying this is why we have to have this medication. And again, these are very expensive medications. So it's a $7,000 a month med, a $10,000 a month med. A medication like that, guarantee is going to be prior authorization. Docs are going to have to justify why that medication is necessary for you to have filled. And again, as long as they do it in the right process and they fill out the right paperwork, then again, those medications definitely can be approved. But it's going to have to be pre-approved before it'll be filled. All right, and so all the formularies are going to have the possibility of having these issues, either not covered, quantity limits, step therapy, and prior authorization. Now, the third feature has to do with out-of-pocket cost stages. And frankly, this is really the most confusing part of Part D plans. I'm going to close out with this because remember earlier I said there were some changes in 2023. Those changes affected insulin, affected immunization, as well as some increases to these out-of-pocket cost stages. So let me explain the changes that we're going to see in 2023 and make some sense out of these 4 out-of-pocket stages.
Hey, my name's Josh Musick, and if you've been enjoying my dad Marvin Musick's content, you really need to go to our website, MedicareSchool.com. When you go there, you'll be given the opportunity to download a free 1-hour Medicare Essentials workshop, and it's going to take you all the way from Medicare A to Z. By the time you're done watching that workshop, you're going to know how to enroll in Medicare, when to enroll in Medicare. You're going to know the differences between Advantage plans, supplemental plans. You're going to know how to get drug coverage. You're going to know everything you need to know to get the best coverage possible. So go ahead, go to MedicareSchool.com and watch the Medicare Essentials workshop.
All right, so here's the stages for 2023. And remember this, if we have a standalone drug plan, remember what that meant? That meant that we had Medicare A and B with the supplemental plan. We have a separate drug plan. So if it's a standalone plan or it's an MAPD, this is when you get a Medicare Advantage plan, which also includes a prescription drug plan. So either one of these are going to have these 4 stages. So stage number 1 is called the deductible stage. When a plan has a deductible, and most of them do, this year for 2023, the deductible is $505 for the year. Okay, now keep this in mind. That deductible doesn't mean that you necessarily have to show up and write a check for $505. What that means, your out-of-pocket costs could be a copay, it could be co-insurance, but there's some out-of-pocket costs that you're going to have. That initial out-of-pocket cost is going to be applied to your deductible. So let's say you're on 2 medications that have a copay of $5 each. That's $10. $10 times 12 would be $120 for the whole year. And if that's all you're going to be out of pocket, you will never even reach your deductible. And many of you watching this video, you won't reach your deductible. Your cost out of pocket are going to be very low. So if I do not reach my deductible anytime in the calendar year, then I'm going to stay in stage 1. And again, I'd say roughly probably 60-70% of all of you, that's where you'll stay all year. But let's suppose I'm on an expensive medication. I'm taking some, patented brand name medication for heart, maybe Eliquis or Xarelto or something. You're certainly going to meet the deductible. So that first out-of-pocket fill is going to be very expensive because you have to meet that deductible and pay a copay. But once I've met that deductible, whenever I do that, now again, that could be in February, it could be in January, it could be in July. So once I have met that $505 deductible, that will then put me automatically into stage 2, which is called the initial coverage stage. Now, the key to this one is this. You're just simply going to pay some very reasonable copays, which are going to be based upon the tier of the medication. Most plans are going to have in the formulary a tier number, tier 1, 2, 3, 4, 5. The lower the tier, the lower the copay. So based upon the tier, whether it's a tier 1, tier 2, tier 3, tier 4, tier 5, you're going to have a copay that will be established by that plan. And so very reasonable copays. But here's the difference. While I'm in this stage 2, what is happening behind the scenes, frankly, in the computer system between Medicare and all the pharmacies is they're actually tracking the retail cost of the medication. And again, you're not paying retail costs. In fact, let's just give an example. Let's say I'm taking Eliquis that costs $500 retail a month. You're probably paying a $45 copay, but the insurance plan that you have, that Part D plan, is paying the balance. But Medicare, again, is tracking the full retail cost. And so each month as you get prescriptions filled, that retail total is growing and growing and growing. It's increasing. And so if that retail total ever hits what's called the threshold, okay, the threshold, And this threshold is established by Medicare every year. And so going into 2023, what we have, the retail threshold is $4,660. Now keep in mind, that's retail. That's not your out-of-pocket cost. In fact, you probably spent maybe $1,000 out of your pocket, and the balance of that retail threshold was made up by the Part D plan. But again, Medicare's tracking this retail threshold. Now, again, I have people right now on $7,000 a month medications. How long does it take them to get there? Well, about 3 weeks. I had a guy recently, as I said, $16,000 a month medication. How long does it take to get to the donut hole? It takes him 1 week. Okay, so my point is they track retail, and if I ever hit that retail, whenever that is, whether that's in 1 month or 4 months or 9 months, but if I ever hit that retail threshold, now I leave stage 2 and I go to stage 3, which is called the donut hole, or Medicare calls it the coverage gap. Okay. All right. And so now in the old days, back when this whole system started in 2006, coverage gap meant you had no coverage whatsoever. You were responsible 100% out-of-pocket expenses if you got to stage 3. That has changed. They improved that over the years. And so what happens, though, in this donut hole, this coverage gap, now you have a flat copay of 25% of the retail costs. And that would be for brand name medications, generic medications. So if I have a medication that retails for $100, and if I'm in stage 3, it costs me $25 copay. If I'm on Eliquis at $500 a month, okay, I'm going to pay 25%. So that Eliquis costs me $125 copay. So when I get to the donut hole, if I ever do, then I'll be a flat 25% out of pocket. Now keep this in mind. It's reaching the retail threshold that put me in the donut hole. Now they tell us that only about 10% of the Medicare population ever hits that number. So 90% of you watching this, you're not going to do that anyways. But if we do, we know now our copay is probably going to increase because we're going to pay 25% of the retail cost. Now, there's a new number that's being tracked in stage 3, okay? And that is called the TROOP, which stands for True Out-of-Pocket Cost. And that for 2023 is $7,400. Now remember, I said just like that number was not your out-of-pocket cost, nor is that number. Basically, out-of-pocket for you is 25% of that number. The balance of that, $7,400, is a credit that the brand name manufacturers have to give you on the medication. So if you're on a $1,000 a month medication and you're on the donut hole, they have to give you a 70% discount. That's $700. And that 70% discount is applied as though you paid it, though you didn't, but they credit that as though you did. So that's what I'm saying. If we ever get to the coverage gap, the donut hole, that $7,400, the most out of your pocket, is going to be about $2,500. That's going to be it. Okay? And so the whole point is you're going to pay 25% out of pocket in the donut hole. And then that takes us to stage 4 if we ever reach this. Now they say only 1 out of 100 people ever get to catastrophic, but those who do, now they're happy because medications are going to be very, very inexpensive here. And the cost for a medication in the catastrophic stage, the most it would be 5% of the retail cost. So if I'm on a $1,000 a month medication, my out-of-pocket expense would be what, $50. If I'm on a $500 a month medication, out-of-pocket 5% would be $25. So you can see medications are very, very cheap for those that get to catastrophic. And this is the one stage that did not change for 2023. Now here's what to note though. In 2024, this is going to change because in 2024, catastrophic stage is going to 0, okay? And so if someone ever gets there, again, 1 out of 100 people would, they would have no out-of-pocket costs once they get to stage 4, all right? But these 3 stages here, we've seen some changes for 2023. Now, the key to this is you want to make sure, folks, that you get on the right prescription drug plan. And even if you take no meds or cheap meds, please get on the plan because, again, your health could change. You could be in a very dire situation needing a drug plan if you don't enroll into one whenever you first go on Medicare.